This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. If you have a high AMH level at 40, the percentage of good eggs is going to be relatively small, but it's obviously giving you a better chance for a pregnancy if you have IVF, because that's where AMH really is really useful, is helping us predict when we do IVF, when we stimulate you with the hormones. It gives us an idea of how many eggs we might collect. In terms of natural conception, people trying on their own with a low AMH level have the same chances as an older woman, as a woman with higher levels at the same age. It doesn't change your chances of natural conception, because the quality of the eggs, the quality of the one egg that is produced each month in natural conception, is the same whether you've got a low AMH or a high AMH level. So if you're planning to keep trying on your own, don't be fazed by a low AMH level if you're in your early 30s. Just keep on trying, and your chances of success in the next 12 months are the same as someone with a normal AMH level. The other parameter that we use is ultrasound. So with very sophisticated ultrasound these days, we can look at inside the ovary and look at these what are called antral follicles. These are follicles 3 millimeters, 4 millimeters across, from which eventually in a natural cycle, one of them will become the egg that's ovulated. And the number of those antral follicles gives another indicator of whether you have a good ovarian reserve or not. Once again, there's a wide range, and it doesn't tell us about quality. All it's telling us about is that that numbers are less than average if it's low. So putting the two together is worthwhile. We generally do that when we're preparing a patient for IVF. Sometimes we get surprises where there's a high antral follicle count and a low AMH, and we end up getting lots of eggs. So it's not black and white by any means. But the important issue is to have a consultation with someone who understands what I've just talked about. If you're in the older age group, i.e. 38 and above, and you've got a low AMH, it probably is important to start to think about pushing on and getting pregnant ASAP. And that may mean moving on to IVF. Okay, so the other topic that we were going to talk about is a little bit of my pet topic at the moment, which is about using ChatGPT as your doctor. Artificial intelligence is changing the world. There is no question of that. And it certainly is a very quick and probably better than Google in the sense of rapidity and probably accuracy, because it collates more information than a simple question in Google. However, and the reason it's sensitive to me is increasingly I have patients coming to talk to me who say, but ChatGPT said this or that for this particular condition. And in most cases, it's in the ballpark, but it's not necessarily for that individual patient. The personalization of advice that comes with talking to a specialist who understands your particular issues is not possible in an AI scenario. You get the general comment, I've got a thin endometrium. Well, you'll get the general comments, all the papers that have been written, all the garbage that it picks up from online sources, which aren't necessarily particularly accurate, because One of the problems we have is that what it's picking up, a lot of it is commercial. In other words, I'm selling you a product, and I'll tell the world that it always works. But an AI picks it up, but it's not necessarily the truth. Coming back to my starting point, your doctor, your specialist who's trained, who's experienced, is the person to talk to about what treatments you should have. Fine, go to ChatGPT and come along with some ideas, but don't believe that what ChatGPT is telling you is actually going to make you any better in terms of your fertility than a fully qualified, experienced specialist like myself. General questions, ChatGPT is fine, but for your individual care and individual plans for getting pregnant, see a good doctor.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.